you. I'm Ted Bruce with Vancouver Coastal Health, and first of all, I just want to compliment First Call and Spark for their persistence in bringing this issue to light and really emphasizing the problem in BC. I also want to thank the Surrey Board of Trade for giving the health message, because it saves us health kits and everything. Thank you for that. So why is this so important for healthcare? I think we all generally know how significant is the impact of low income and poverty on people's health. It's been widely reported, and I again realize when we see so many media here that it's really capturing the attention of the public. But a lot of times people don't know how significant that impact is. And there's a huge number of statistics I could quote to show you that relationship between low income and poverty and health. But let me just pick out a couple for you that are quite significant. First of all, we know that there can be a huge gap in the mortality of people who are living in poverty compared to those living in higher socioeconomic conditions. It can be a 10-year gap in life expectancy. Perhaps more importantly, from the child poverty side of things, there's huge data that shows that children who are in low socioeconomic communities have greater, more problematic problems with their health care and their health status over time. The Urban Health Officers produced a report a few years ago, and it demonstrated that children who live in low socioeconomic conditions utilize hospitals for asthma 1.7 times more than children in higher socioeconomic conditions. So that's a terrible statistic when we think about the fact that children in low socioeconomic conditions are experiencing hospitalizations because of the conditions in which they live. And another important one that was referred to is in terms of early childhood development. When we look at the vulnerability of children, those kids who are living in low socioeconomic conditions can have double the challenges that those who are in higher socioeconomic situations. So the health impacts are huge. One of the things that we know a lot more about is that the typical myths about who is living in poverty need to be exploded. A lot of folks in our society think that these healthcare problems are related primarily to alcoholism, substance use, those sorts of mental health issues that manifest themselves in the very obvious kinds of things in our society. And we know that's not the case. When you look at this report, you can see the working poor numbers. So that's a sign that we're not just dealing with some of these more obvious problems. But what we know in healthcare is that there is a gradient between those from the lower income to the higher income in relation to their health. So those who are at the top of our income scales, they have better access to education, they have more access to nutritious food and good housing, and they have the most control over their life circumstances. And that puts them in a situation where they're at the top. They live longer and they live in better health than everyone else. But that gradient is there. So we know, for example, people sort of in the middle income area, in the middle of our socioeconomic status communities, have adequate resources and they have, control over their lives. But when we look at their situation, people in the middle are less healthy and live shorter lives than those higher up. And then when we go to the lower socioeconomic folks, those folks are at the bottom, that they have lower education, they have poor quality food, they have inadequate housing, and little control over their circumstances. Those at the bottom are twice as likely to have a serious illness and die prematurely than those at the top. So it is very significant for us to try to address this issue of low income and poverty. We know the pathway for this to happen, particularly for children. It is related very much to their daily stress that they experience due to their life circumstances. A number of people in the healthcare system recently took the food challenge that the Raise the Rates group put on. Give people at least even 1 week of experience living with low income. And in that week, people from the healthcare system report quite clearly, even just for a week, that they were under a great deal of stress just trying to manage that food budget. So we know that there's a pathway between the stress that people in low-income circumstances have every day, over and over again, and their physiology and biology, and it manifests itself over time in chronic illness. So one of the things that we emphasize from the healthcare system as an investment in poverty reduction, as it's called for here today, is actually an investment in health, and is probably one of our best mechanisms for the prevention of chronic disease. So in conclusion, I would say that it's very difficult at times for us to recognize the long-term implications of the low-income situation for people, but it does have a very significant impact on their health over time, and we need a long-term investment in addressing that to improve the health of our population.